Hello, my name's Hayley and I'm one of the nurse specialists at Velindre Hospital. I hold a immunotherapy patient education workshop and I've made this video so that patients who are receiving immunotherapy are able to view it at their leisure to get some information about what immunotherapy is, how it works, what the side effects can be, and importantly, what to do if you should suspect that you are experiencing side effects. What is immunotherapy? The type of immunotherapy that I'm discussing in this educational video is an immunotherapy called checkpoint inhibitors. Immunotherapy is very, very different to chemotherapy. Immunotherapy works by increasing your body's own immune system to fight cancer cells. It does this by working specifically on your T cell. A T cell is part of your immune system. I want you to imagine your T cell as a circular shape with a giant T, a light bulb and a light switch. Okay, bear with me. So, we know through clinical research that certain cancer cells are able to turn our T cells from a lights on, switched on position, to a turned off position, i.e. they turn our T cells off, therefore stopping them from recognizing cancer cells and being able to do their job, which would be to fight cancer cells. Cleverly, what checkpoint inhibitor immunotherapy does is it stops the cancer cells from being able to turn your T cell from an on position to an off position. So, if you imagine your T cell with its capital T emblazoned across its chest, your light switch is now not able to be switched off. Once you've received a dose of immunotherapy, your T cells are stuck in the on position. Your light bulb on your T cell is illuminated. This makes the T cells in your immune system ready to fight cancer cells. Why is immunotherapy used? Your oncologist will have discussed with you the reason why you're having immunotherapy and will have chosen with you the best type of immunotherapy for your cancer type. We use immunotherapy on its own, and in some settings we give immunotherapy and chemotherapy together. We can also sometimes use immunotherapy for patients who have had their cancer surgically removed, and we give immunotherapy to reduce the risk of the cancer from recurring. Types of immunotherapies or checkpoint inhibitors. Now these drugs are not easy to say, so you'll have to bear with me and have a practice at home. Okay, atezolizumab is a drug that's given every 3 weeks. The first treatment takes about 1 to 2 hours and subsequent treatments take 30 minutes to an hour. Avulimab is given every 2 weeks and this takes about 1 to 2 hours to give. Durvalumab is a 3-weekly treatment and it takes about 1 to 2 hours to receive. Ipilimumab and nivolumab are 2 types of immunotherapies given together. You would only receive 4 cycles of this treatment, and because there are 2 drugs, this is the longest treatment and takes about 4 hours. Ipilimumab on its own is given every 3 weeks, and again you would only have 4 cycles of this treatment, and that takes about 2 to 3 hours to receive. Nivolumab can be given either every fortnight or every 4 weeks, and this takes 2 hours. Semolipumab is given every 3 weeks, and that takes about 1 to 2 hours. All of the immunotherapies are given as a drip, so a small flexible tube will be inserted into the back of your hand. The treatment's then given. Once the treatment's been received, the small flexible tube will be taken away. All of these drugs are approved by the National Institute for Clinical Excellence. On the day of your treatment, you can eat and drink as normal. It's a good idea to bring something to keep you entertained, as some of the longer treatments can be very boring. So bring either a good book or a portable device. If you are going to listen to any music or watch a film or any episodes that you're enjoying on a box set, please make sure that you bring a headset with you and that your portable device is fully charged to reduce the risks of trips and falls. The treatment chairs are quite comfy. They recline and they have pillows, but if you want to bring something to make yourself more comfortable, you can bring a blanket if you like. Also, we advise that you do not drive yourself for your first treatment appointment. That's just in case you should feel very tired and not feel up to driving yourself home. If you can't bring anybody to drive you, then you can ask for hospital transport, but we do require at least 2 days' notice to book transport. So if transport is something that you need, then please let us know in clinic. Side effects of immunotherapy. Firstly, it's really important to say that not everybody who has immunotherapy experiences side effects, and side effects vary in severity. Side effects are generally easily treated if captured early. Report your side effects to the treatment helpline. Immunotherapy is not likely to make you feel unwell when you receive it. It doesn't really carry a risk of an allergic type reaction, but we can all have reactions to different things, even things that you buy in a supermarket or in a chemist. So if you do feel unwell, i.e. lightheaded, hot flushed, or have pains in your chest or your back whilst you're receiving immunotherapy, we would recommend that you let the nurses on the unit know as soon as possible. This is a very, very small risk, however. So, side effects. So I'm going to talk you through some of the most common side effects that we see with immunotherapy. Doesn't mean that it's a side effect that you'll experience, but these are the ones that we see frequently in clinic. We know that immunotherapy can change the way that your bowels behave. Once the T cells have been turned on, if they cause an inflammatory response in your bowel, it can present like diarrhea. If you have 3 or more episodes of diarrhea in a 24-hour period, we want you to tell us about it. If you have any abdominal pain, discomfort, or past blood or mucus with your diarrhea, then we really do need to know as well. We also know that immunotherapy can cause rashes to the skin. It can also cause ulcers and soreness to the mouth and inside the lips. So if you have any new rash, any itch, or any changes to your skin whilst you're receiving immunotherapy, we would like you to pick up the telephone and call the treatment helpline. Now, there are things that you can do to look after your skin, like not using soap to wash your body, so don't use a soap product in a bath or shower, and keep your skin well moisturised. So use soap-free body washes and a good, gentle, non-perfumed moisturiser. This will keep your skin nice and healthy. If you have a rash to a small area of your skin, we will frequently prescribe a lotion to help with that. But if it's more of a generalised rash, so it might be more severe because it's covering a larger surface area of your body, then we will give you steroids, and this will just dampen down your immune system, stopping the rash. Now, fatigue is a common side effect with a lot of the treatments that we give at Velindre, and sometimes just travelling back and forth for hospital appointments and treatment appointments can make you feel tired. But the type of fatigue that I'm talking about that's caused by immunotherapy is very extreme. So it's a kind of fatigue that would mean that you're falling asleep during a conversation, maybe even this video, hopefully not, but falling asleep when people are talking to you, or falling asleep whilst you sit down in the chair. Now, if that's not something that is normal for you, and you find yourself nodding off whereas normally you wouldn't, that could be a sign that the immunotherapy is making you fatigued. And we would need to check some bloods from you to make sure that we're not affecting some of your hormone levels. And I'll come on to that a little bit later. So we also know that immunotherapy can cause a new cough in patients. So what we would recommend that you do, if you notice any new cough or any new changes to your breathing, that you contact our treatment helpline. Now, changes to your hormone producing glands is something that can also happen with immunotherapy, and the type of hormone glands that we're talking about are the glands that your body uses to produce thyroxine, adrenal glands that give your body its energy, and your insulin producing glands, and also sometimes your fertility glands and your sex hormones. So with regards to fertility and immunotherapy, if you are of childbearing age, and you want to start a family, we would recommend that you have a discussion with your oncologist or your nurse specialist about possibly sperm collection or egg collection prior to starting immunotherapy, because side effects of fertility and immunotherapy in the long term are not known. But if you are not considering extending your family and you're sexually active, we would recommend that you use barrier contraception, male and female barrier contraception. So do not father a child or become pregnant whilst you're receiving immunotherapy. Okay, so I'm going to talk you through your immunotherapy alert card. Now, we recommend that you carry your immunotherapy alert card with you at all times and keep it in your wallet or in your purse, and carry it with you for up to 2 years after you complete your immunotherapy treatment. And the reason why we ask you to carry it with you for 2 years is because we know that once we've stimulated your immune system, once your T cells have been switched on by the immunotherapy, that response can stay with you for a long time, which is great because it means the effects of the immunotherapy are still active. But it also means that side effects can also occur up to 2 years after you complete your immunotherapy treatment. So please carry this card with you, and if side effects crop up after you complete your immunotherapy, and if you start to develop a rash or a new cough or any of the side effects that we've been through, or anything that's different for you, it could well be still due to the immunotherapy, so call the treatment helpline. Okay, so I'm just going to show you, this card actually folds down, so it's like a little concertina card. So you just fold that down, like so. And you can carry it, it's wallet size, so it comes in quite handy there, wallet size card. Now, also you will notice on this card you have your telephone number, the contact telephone number, which you ask for the treatment helpline. Now this is a 24-hour telephone number, 365 days a year. So you call this number, you ask for the treatment helpline, and you'll be put through to a dedicated call handling team. And they will, what we call in the business, triage your call. So they'll ask you some questions and put you in touch with the right treatment, okay? So, and also on the back of your alert card, you'll have your hospital identification sticky, which will have your unique Velindre number. And also on the bottom here, we'll have the immunotherapy that you're receiving. So whenever you call the treatment helpline, it's important that if you forget to tell us your name or your contact number, if you tell us your V number, if that's the only piece of information you give us, that's okay, because we'll be able to find you on your electronic record, and then we can have access to all the information about you. Now, on this side of the card, you have a QR code. Now, this QR code is something that can be downloaded If you take your smartphone and you scan that QR code, it will ask you to open a file, and that will take you to a document that's it's aimed for medical professionals, but it's a good document to have if you want to know a little bit more information about the side effects and how they're managed. Equally, if you're admitted to another hospital, maybe whilst you're on holiday, for example, carry this alert card with you and encourage the doctor or nurse that's looking after you to scan this card, and it will take them to that document. So that's a really useful top tip. So why is it important to tell us if you're concerned that you're experiencing a side effect? Well, we want you to carry on receiving your treatment, and if you don't tell us that you are poorly or that you're experiencing a side effect, then we can't manage that side effect quickly, and if we can't get on top of it quickly, then the side effect will become more severe. So the quicker you tell us, the quicker we can assess you and manage that side effect and minimise the impact that has on your treatment going forward. And like I say, side effects can develop up to 2 years after completing treatment, so it's really important that you bear that in mind and carry those alert cards with you. Now, side effects don't usually follow any particular pattern necessarily, so side effects can emerge at any time during your immunotherapy treatment, so don't be complacent. If side effect should crop up, then please report it. Thank you. So I'm also going to talk to you a little bit about my top tips whilst you're receiving immunotherapy. So what I recommend for patients when I usually run this education workshop to people is to keep a diary of how they're feeling. Writing things down can be really helpful, not just emotionally and for your psychological well-being, but it can also help you to keep track of how you feel, because you can forget how you felt yesterday or the week before, and then when we see you in clinic or we speak to you on the telephone to ask you how you're doing, you might just go, yeah, no, I've been fine, and you've forgotten how you actually have felt. So it's a good idea to keep a little note. It doesn't have to be a mammoth diary entry unless you want to, of how you're feeling, of any niggly symptoms that may crop up, so that you can keep an eye on those and let us know in clinic. We also recommend that patients who are receiving immunotherapy, the checkpoint inhibitors, have the seasonal flu vaccine. That's something that we encourage our patients to do. Another top tip would be to get an eye test before you start your immunotherapy. So if you haven't had one recently or have never had one before and you're due to start immunotherapy, we would say just pop along to your local optician and get an eye test, and that can just help us going forward. If you should experience any changes to your vision once you've started immunotherapy, we would ask you to have an eye test. So if you have one before you start, then we know what your eyesight's like before embarking on treatment. So don't worry if you haven't done it and you've already started your immunotherapy, but if you can book one with your local optician, that would be fantastic. And before, we used to get asked quite a lot about the use of cannabis oil and immunotherapy, and recently a research paper has come out that has suggested that patients who are having checkpoint inhibitor immunotherapy, we recommend that they do not use cannabis oil or CBD derivatives, as the CBD actually dampens down your immune system, and with immunotherapy we are obviously trying to stimulate it. So frequently asked questions. These are questions that I've been asked when I've held this patient immunotherapy workshop, usually in a group setting, and in our current climate I'm not able to do that, hence the video. So in the first instance, I guess it's really important I say, if you're looking for information about the coronavirus, or you've got any questions or want to know up-to-date advice, then I would recommend that you look at our Velindre website, and the web address for that is www.velindrecc.wales.nhs.uk. So questions that I get asked then are, will I have an allergic reaction to immunotherapy? Now, my answer to that is this is unlikely. But if you should feel unwell whilst the immunotherapy is being given to you, let the nursing staff know straight away and they will act accordingly. Will I have a super strong immune system? No, you won't have a super strong immune system. You don't have any extra immunity to viruses, etc. But you don't have a lowered immune system in the same way that a patient receiving chemotherapy would. Will I lose my hair? This is very unlikely. The majority of patients receiving immunotherapy do not lose their hair. Some do report some hair thinning, but that's very few and far between. Can I have access to hospital transport? So hospital transport is available, but there is a high demand for it. So you sometimes need to wait a while to be picked up and taken home. If you wish to use hospital transport, please provide as much notice as possible for us to arrange this for you, and we will do that. Should I change my diet? You should continue to eat a healthy, well-balanced meal with lots of variety. That would be my top tip with regards to your diet. Should I avoid friends and family members who are unwell? Well, in light of our current COVID-19 outbreak, you should seek advice from local government publications, but under any normal circumstances, then I would say use common sense. If you are mixing with young children who have got lots of bugs or chicken pox, then no, steer clear. But otherwise, out of these extraordinary circumstances, then you would be able to continue being out and about, but currently not with the COVID-19 because we are all under lockdown, aren't we, at the moment? So I hope you've enjoyed my session. I just want to say a big thank you for bearing with me, and wish you all luck with your future immunotherapy treatments. And I'm sure I'll either speak to some of you over the telephone in the coming weeks and months, and may even meet you around the hospital or see you in outpatient clinics. So all the very best, and thank you for watching. Thank you.